Welcome back to another episode of NARAL's The Morning After. I'm Gabe, and here I've got Lauren Blauvelt and Danielle Craig from Planned Parenthood Southwest Ohio region. They came up for the day for an event at the State House, but the big news this week nationally was the Pink Out Day. What happened yesterday?
Planned Parenthood supporters showed up in, I'm going to say millions. I'm ready to say millions. Online and in person to really paint the country pink, because we have supporters in every state, in every city and town and college campus. Right. And it's time our legislators know that. So right. We asked everyone to wear pink and to pink out, and they did. And in Ohio, as much as anywhere else. We're very excited about it.
Yeah, this was a huge national, took over Facebook, took over Twitter. Mm-hmm. And yeah. The national campaign was timed to coincide with Cecile Richards testifying before Congress. I've got the quote from her here in the New York Times. She said, "The latest smear campaign is based on efforts by our opponents to entrap our doctors and clinicians into breaking the law. And once again, our opponents failed." That was Cecile in front of Congress. What do you think about that?
I think she's amazing. I think we are fortunate that she's the one leading this charge, because she really understands, what our patients need, what our staff needs, and she really understands what we're up against, and she's going to fight it out till the end. So I'm really grateful that she stands up for us.
Absolutely. I think the word going around the internet is shero.
Yeah.
She's our shero.
She did an amazing job. That committee lasted 5.5, nearly 6 hours.
Yeah.
And she just, the word I kept seeing on Twitter the most was badgering, mm-hmm. where they just threw every single thing at her that they could find, and nothing sticks.
Mm-hmm. That's exactly right.
So, the comment from her that they haven't found anything because there is no wrongdoing has been backed up by the Ohio Attorney General. The Ohio Auditor was just out this week releasing his findings. All of these claims are proving to be just complete false accusations.
Absolutely. We can say too, we had in PPSWO in Southwest Ohio, we had ODH came out in August and did a thorough inspection, and we actually received our report that said they specifically found no issue with the way that we handle tissue donation. So, we're waiting for the Ohio Attorney General to back that claim, but ODH has been out and done the report.
Is there any expectation that Mike DeWine is going to bend over backwards to make sure everyone understands that these are all false allegations? Nobody's jumping up to support Mike DeWine in this.
Next question, please.
Next question. Okay. But it's not just Ohio. There was an investigation in Missouri yesterday mm-hmm. where it was their state attorney general that says, hey, we've looked into this. We didn't find anything.
Mm-hmm. Absolutely. I think a big story we all read was Florida. Their investigation went well, and the governor, I guess I should say, didn't put out the information. He deleted the part in the report where it said that no wrongdoing had been found, or
swept it under the rug.
Yeah, absolutely.
Okay. So
at least in Ohio, they put out the real report. We'll give them that.
Okay. So the big story was Cecile defending mm-hmm. And everybody across the country going pink for Planned Parenthood, and they've got her back.
Absolutely.
That was amazing. And you said that you were up in Cleveland. You're from Cincinnati, but you drove up to Cleveland.
Exactly. This was an all hands on deck kind of action day, and we have supporters across the state, but because we are a nonprofit, that doesn't always mean we have staff across the state, and we are lucky to have so many supporters and volunteers that we had the need to spread out. And we had a big rally in Cincinnati, about 100 people showed up there, and we had about 50 in Cleveland throughout the entire day. Cleveland supporters showed up from 10 to 4. It was a long day, and both rallies were in front of health centers where we were also providing free HIV testing during the time. And it was really awesome. You know, our supporters were out there in pink with signs, and just if the number of honks we got on the street were, you know, voters who support Planned Parenthood, then we're going to be just fine in Ohio.
Right. Okay.
I'll add to that too. In Cincinnati, it's really uplifting for our staff to see that, because they walk through protesters' antis every day to get to work. They get yelled at. They get have a lot of nasty things said to them, and to be out there and see what the supporters really look like, I think is really uplifting for all of us.
Mm-hmm. So absolutely.
Okay.
Yeah. So it was a fun day. We were excited to pink out.
Absolutely.
Good. It sounds like you guys have needed a fun day. Your affiliate specifically has been under attack from the Kasich administration. Can you talk about that?
Well, we actually, just to kind of back up a little bit, we filed a federal lawsuit in August, challenging basically the Ohio Department of Health's restrictions, the written transfer agreement and the variance provisions being applied to our surgical center. And we did that because we had a transfer agreement with UC Medical Center in 2013, but when the law went into place saying that public hospitals couldn't work with abortion providers, we lost that transfer agreement.
Because UC is University of Cincinnati, and that's a public entity.
Correct.
Okay.
So basically from there, we filed for a variance. The remainder of the hospitals in Cincinnati, aside from one, are religiously affiliated and aren't willing to work with an abortion provider. So we filed for a variance to that written transfer agreement. And about 14 months later, we still hadn't heard anything. We ended up filing another lawsuit in federal court to get ODH to approve it, which they did. So it's just kind of been a lot of moving the goalpost, if you will, on us. In June, then the Ohio legislature then added another law, which basically provided that the variance requests were automatically denied if they were pending with the ODH director for 60 days without action, which basically kind of set the clock for the eventual denial of our most recent application for variance and our license. So we couldn't wait any longer without risking the closure of our surgery center.
But the Department of Health, they're looking like it's clear that they're doing everything they can to deny your license. Is there any like legitimate grounds for denying this?
As far as we can tell, no. I mean, we pass all of our inspections with flying colors. You know, we had our variance request was approved after that 14-month period last year, and the federal lawsuit, which sort of forced the issue. We received a notification on Friday that our most recent filing that was made in May with our license renewal was denied, and it was denied on the basis that we didn't have enough backup physicians. When we, when we had our received our variance approval last year, we had 4 backup physicians in our plan. Now we have 3. So ODH has indicated that is not enough.
How many backup physicians does somebody actually need?
There's no requirement. I mean, there's no written regulations on this. So it's kind of, you know, we do what we think is right to keep our patients safe, and then we hear back that we need more. So
they're telling you that there's some magic number. The magic number isn't written down anywhere, but you miraculously haven't gotten it yet.
That's exactly right. So basically what we did is we worked with the judge this week to put a plan in place that would not have the new law apply to this variance request that we filed in May, which would automatically suspend our license based on this variance denial. And then we went ahead and filed another variance on Monday with a 4th physician. So we're doing everything that we can to appease, you know, the lawmakers in Ohio, but and patient safety obviously is our number one concern, but we just don't feel like this has a lot to do with patient safety.
No, absolutely not. And I mean, we haven't even needed to have a patient go to a hospital since
had before she was seen. So she was in the waiting room. A couple others were allergic reactions to medication. So it's a very rare occurrence. And we actually are about a block from Christ Hospital and a mile from UC Medical Center. So in the event that we did need to transfer a patient, we could do so very, very quickly.
And even without any sort of transfer agreement, I mean, they're a hospital. They have to accept a patient and, in need.
They're
Absolutely.
obligated by law. So one of the things that we go back and forth on is if you are really concerned about patient safety, you wouldn't have a prohibition on public hospitals working with abortion providers, because public hospitals are great organizations, and particularly the ones surrounding us, and would be a great place to send our patients, and there shouldn't be an issue. So if you are really concerned about patient safety, that would be the number one answer.
Okay.
So
Absolutely.
So the Department of Health is just asking you to jump through hoops, and meanwhile, they've got guys in the back making new hoops.
that's a bit what it feels like, to be honest.
Okay. And so their goal is to completely shut down the abortion services for the affiliate.
Mhm.
What would that mean to the people that you see coming to your door looking for care?
About 61% of our patients on the surgery side are at or below the poverty line. So when you're talking about taking time off of work, when you're talking about having to travel hundreds of miles to receive the care that you need, it's not really feasible for a lot of people.
No, and having to find childcare for their other children, because most of the women we see in our surgical center are already mothers.
Mm-hmm. And so when you're talking about all of the sort of laws that have been enacted in the last 2 years, and we're facing closures in Toledo, in Kettering, which is Dr. Haskell's facility, and in Cincinnati, you're talking no abortion provider in the entire western half of the state. Where are these people going to go? I mean, we see people from Kentucky and Indiana too. Where are these people going to go?
Right. We, our area, just in Southwest Ohio, sees over 3 million people.
3 million people.
That's how many people live in Southwest Ohio.
Right. But I mean,
we're the only abortion provider. So,
right. So it'll be the largest metropolitan area in the country without
Absolutely.
an abortion provider.
That is true.
And this is basically the stated, almost stated goal of the Kasich administration.
Right.
Absolutely.
I mean, I think we're pretty clear this isn't about patient safety. It's about eliminating access to abortion care for women in Southwest Ohio, and ultimately, eventually, the entire state if it keeps up.
Okay. So that's a good transition for what happened today. Today, you guys are in Columbus for an event that was at the State House. A panel of legislators, Kelly Copeland and Planned Parenthood's Stephanie Kite were up on the panel to announce a new package of legislation. Representative Greta Johnson is announcing 6 bills, which basically tackle every sort of restriction that's been thrown at abortion providers, like PB-SWO, attacks on, this would reverse the attacks on funding. It would remove these abortion restrictions that's causing you, problems with getting that license approved. It would tell CPCs to stop lying to patients. If you're going to take TANF dollars, if you're going to take tax dollars, you can't tell lies, and that's what CPCs have been doing. What do you think about the legislation that was announced today?
We love it. I think that it's important for our supporters to see, for our patients to see, and for our staff as well to see legislators who care about healthcare, care about providing, helping us provide the best healthcare that we can, instead of blocking access. They're actually paying attention to what's going on, and if the 6 bills that were introduced today were actually able to move through the Ohio legislature, we'd be able to provide the top quality care in Ohio to thousands and thousands of women, whereas now all the restrictions have really made it hard, and we already see that. They talked at the rally itself about how our health statistics in Ohio, we have the worst infant mortality for African American women. We're 47th overall, and we need to be doing everything we can in Ohio to fix that health crisis. And instead, the Ohio legislature is spending time attacking women and families and attacking that reproductive health care that it would actually prevent infant mortality, which is what we should all be doing.
Right. And today's event, I mean, there was some firebrand going on there. I mean, Janine Boyd stepped up and was discussing all of the attacks, all of the neglect, I should say, ways that the state of Ohio has been neglecting its citizens in need. She used the phrase deadbeat dad to refer to the state government. I hadn't heard that one before. I thought that was pretty good. How about you?
There was a lot of head nodding and a lot of like, yeah.
A little cheering going on at that point. Yeah.
Yeah. And the line from Greta Johnson I thought was great. She said that we are not the damsels in distress being tied to the train tracks. We are the train. So this is new. This is going on the offensive. I haven't seen.
We're ecstatic. And it's what we need. I mean, Ohio is, we think, a very important state, and we're known the world over for our top health providers, and women living in Ohio deserve to have the same. It, we have laws in Ohio that say that women can't use their insurance to pay for, the birth control that they want or the provider that they want. I mean, that's not freedom.
Okay. So we're fighting back.
We're fighting back.
Feels good.
Yes, it does. So also in the Cincinnati area, you guys are home turf to, for now, Mr. Speaker, the Orange Man, John Boehner, but he's out.
He's out.
This was huge news. Lauren, you've had interactions with the Boehner office over the years.
I have. Yes, we are lucky, and I'm sorry, sarcasm doesn't feed well on YouTube, right? Yes, we've hosted the Speaker of the House for the last 3 years, and we've had many occasions to kind of come up against his policies, trying, especially Speaker Boehner's attacks on healthcare and the Affordable Care Act, and Planned Parenthood is a healthcare provider. All of their healthcare, not just at Planned Parenthood, but at primary care facilities and everything. So when I was, a few years ago, me and some pretty awesome activists took hundreds of boxes of ramen noodles to the
ramen noodles, like the little 30-cent packs of noodles.
Yes, but they're much heavier when you put them in boxes.
How many boxes were there?
I think we had like 500 boxes.
500.
It was a lot. We filled SUVs as you can imagine, they did not accept all of the boxes, but we dropped off as many boxes as we could fit in his Westchester office. And the point was that women were going to save a significant amount of money and hopefully not spend it all on ramen noodles, but $600 is for one woman a year.
This is $600 worth of ramen noodles.
That's groceries. And
SUVs full of groceries.
Exactly. So we wanted to make sure that the Speaker of the House, who was, representing the women living in our region, knew that he was actively voting and pushing for them to have less money and less health care.
So this was kind of the first, I think it was the first time the federal government talked about defunding Planned Parenthood.
It was right. Yes, it was at that time.
This was Obama came in, and the first reaction was, well, we can't have this guy for president who supports women's rights. Let's defund Planned Parenthood.
That's how it felt to us.
And so you were dropping off
a
year's worth of groceries or $600 worth of groceries to show what birth control cost a person for a year and what the equivalent was in food.
Absolutely.
Do you think that they were just thrilled and they got the message?
If you're asking if they called the police, then they did.
Because you were dropping off ramen noodles.
I feel like that's a gift.
Exactly. We were very polite.
You weren't throwing the ramen noodles.
Oh, no, we carried them in very nicely and set them in front of his secretary's desk. But no, we did not get to see Mr. Speaker, but they knew that we were there.
Right.
I think we had a rally there once where we could tell he was there because there was a lot of Secret Service, and they were definitely very nervous about us. And we didn't even know he was there, so it wasn't on purpose. We had to fight. We had to show up at his office a lot, actually, to support the Affordable Care Act, and specifically making sure that birth control would have no copay, because that would make this most significant difference for all of our patients.
It sounded like these were things that he was opposed to.
Yeah, he was actively opposed. It was definitely, whether it was the first time that Planned Parenthood was attacked nationally, it was definitely the first time birth control and using family planning was attacked on such a national level. So
now he's out. He's been the opposite of a champion for women's health. He's been terrible for women's health.
He's been terrible.
So do we think this is a good thing or a bad thing that he's out?
I think it could go either way. I mean, it kind of depends on who replaces him.
Yeah.
Right. I mean,
I think we're still a little apprehensive. I mean, he was speaking for his party and for, many representatives. And I think we're still fearful that whoever takes the officeship, whether they probably won't be from Ohio, so it won't be maybe as personally embarrassing for some of us just, living and voting in the area.
Right.
But I don't know that we expect it to dramatically change the national health policy.
Actually touches your guys' affiliate area of Jim Jordan.
Mm-hmm.
He's this sort of squish of conservative Ohio up to the western central part of the state.
Mm-hmm.
So I think, we're all nervous to see exactly how much power the Tea Party side of the House and members of Congress like Jim Jordan end up having with whoever the new speaker is. So,
yeah.
Yay.
Never a dull moment.
Okay.
Right.
Okay, so let's close it out with our Let's Get It On segment. What are you guys having coming up in the Cincinnati area that you want to let your supporters know about?
Sure. Coming up this Saturday, October 3rd, we have our Diamond Awards Gala where we are honoring Carol Cable, who's a previous board member for us and a big champion for women's health.
Absolutely.
So we're honoring her. That event in and of itself is sold out, but prior to that, there is a cocktail hour there are still tickets for. It is diamondawardsgala.org. If you'd like to buy tickets, you can also bid on any of the auction items all online. But it's a great event. It's a lot of fun. And the cocktail hour is a really great way for young supporters to kind of get to meet some of our more seasoned champions that have been doing this for a long time and have really great stories and really good attitudes about fighting. And, we're all in this together. So
absolutely.
That's great.
And to keep the fighting going, we do have volunteer phone banks happening twice a week in our Cincinnati offices and coming to Dayton at a date near you. Dayton and Cincinnati phone banks, Tuesdays and Thursday evenings from 5 to 8. And we really need as much help and support to do that because we're calling Ohio voters and we're calling supporters because, we're all busy and certainly it can be difficult to follow along with all the different attacks, especially happening in Ohio. So we have volunteers call people and just let them know what's going on and what they can do. And what they can do is to show up to rallies like today, and but they can talk about it online. They can write a letter to the editor, make sure your voice is heard. And we are also always welcoming patient stories. And, if you're a supporter of Planned Parenthood and you've used our services before and you'd like to share your story, we'd really love to hear it. And love to make sure that the Ohio legislators hear it too.
Okay. How can people get a hold of you to volunteer?
Can I just give my email address?
That's up to you. So, well, they can find you at ppswo.org.
Absolutely. ppswo.org and ppao.org. I'm also on Facebook, Lauren Blauvelt -Copeland.
And
check me out.
If you join the phone banks, Lauren always buys dinner, so that's exciting.
Nice.
I do.
Okay. And if folks want to volunteer with NARAL, it's volunteer@prochoiceohio.org. We have 2 events coming up in October. You guys should totally come to them. It's Comedy for Choice. October 15th in Columbus, October 16th in Cleveland. People can find out information at prochoiceohio.org to join us for those. Awesome. Okay, that was the show. How do you guys like it?
Yeah.
Great.
Thank you. Thank you for having us.
We'll see everybody next week. Bye.